Before preparing your insulin dose, thoroughly wash your hands using soap and water. This should be done no matter what type of insulin product you have. Prior to withdrawing the insulin, inspect your vial. Be sure to check the expiration date as well as for any signs of insulin breakdown within the vial, such as long streaks or clumps. If the vial is expired, or when you first acquired the product, do not use it. Obtain a new vial as soon as possible. Once your insulin has been inspected, if you have a cloudy type of insulin, gently mix it by rolling it back and forth between your hands. Do not shake the insulin. If your insulin is clear, you do not need to do this. If using a new bottle of insulin, remove the colored, flat plastic cap that is on the top of the vial. The rubber stopper should now be visible on the top of the vial. Clean the rubber stopper on top of the insulin vial using an alcohol pad. You should do this each. Safely remove the cover of the needle on the syringe. Take care not to let the needle touch any surface other than the vial of insulin, or your skin, where you will inject the insulin. If you are to inject 10, gently push the tip of the needle through the rubber stopper and push the air in the syringe into the vial of insulin by pushing down on the plunger. With the needle tip still in the vial of insulin, turn the insulin bottle and syringe upside down, holding the vial of insulin. If air bubbles appear in the syringe after you pull up the insulin, gently flick the syringe with your finger to make the bubbles rise to the top of the syringe, and push the insulin back into the vial. Draw back on the plunger a second time to get the desired dose. Very tiny bubbles are not a concern. Pull the syringe out of the insulin vial and double check the dose withdrawn. Make sure that there are no large air bubbles present within the syringe. And vials, some insulin available in pens needs to be mixed. The needles that are to be attached to the pens come separately and must be attached to the pen prior to use. Pull the cap off the needle, then push the needle straight onto the pen through the rubber end. Screw the needle onto the pen now needs to be primed. Dial up 2 units by turning the dosage knob on the top of the pen. Some pens require that you pull the knob out as you do this. Point the pen up and tap the cartridge to collect air at the top. You may need to flick the pen to get the bubbles to the top of the pen. Push the knob in until it stops and 0 is seen in the window. The pen is now primed. If the little priming steps again. Next, twist the end of the pen until your predetermined insulin dose is indicated by the number in the window. The pen is now ready for injection. After injection, use the outer needle shield to cover the needle. Unscrew the capped needle insulin. The optimal place is the abdominal region. In order to avoid the development of scar tissue, the 10-finger technique can be used to spread out the locations for each injection. Simply spread your hands across your stomach and rotate injection sites based on the location of the spaces between your 10 fingers. Before injecting the insulin, clean the area of injection with an alcohol wipe or with soap and water. It is important to allow this region to dry before injecting your insulin dose. Pinch a large area of skin where you wish to give your insulin dose. Push the needle all the way into the skin at a 90-degree angle. If you are a very thin person or a child, the needle can be injected at a 45-degree angle. With the needle in the skin, slowly push the plunger all the way down and release the pinched skin after all the insulin has been injected. Pull the needle straight out of the skin. Do not rub the skin at the injection site.